smile. Some people, when they smile, they show a lot of the gum. And there's many causes for this excessive gingiva. Right? So this is what you need to do ahead of time. You have to make sure that there's a safe amount of gums that you can trim off. And usually that's done by probing. So what are you probing? You're probing to see how deep the pocket is. Usually you're probing all the way to the bone. And we're not going into detail, but there's something called the biological width, which means how far away from the gums to the bone. There's actually a magic number. So you can't just trim the teeth back to bone, because in dental school you'll learn that that's not good. So there's only a certain amount of the gums you can trim off. So that's why you have to probe all the teeth and make sure, or you have to probe the teeth that you're planning to do any lasering, so you can actually create, go from the top left to the bottom left. So how do you know how much to trim off? This is sometimes what the lab can provide you. The lab will provide you with what looks like the ideal teeth, and then they can actually send you a guide. So this is actually called the laser guide. So they will actually show you where to trim. Of course, the lab technician, they're not, most of them are not dentists. So they don't know about, how much gum to trim off. So as a professional, as a dentist, you have to be able to understand the biology and understand, how much gums is too much and how much you can reduce. So gingival architecture is really looking at how the gingiva, are positioned with each teeth, because there's actually a ideal position where the gums are set. Generally, the lateral teeth, the gums, when it's slightly lower, it looks a little bit more natural. But when it's too low, then that lateral teeth start to look really stubby because it's already short. So it starts looking like a square.